Well, welcome everyone. We're excited to be back at the VEITH 2022 meeting for the first time in New York City in 3 years. It's so great to be back. The energy here is amazing. There are just so many great talks. My name is Benjamin Starnes from the University of Washington. I have Randy Moore here with me and Ross Milner from Chicago. And I want to bring up the topic of artificial intelligence. Now, we all use artificial intelligence every day. Whenever we Google something, we use artificial intelligence. But how can we use artificial intelligence to leverage data for the benefit of our patients?
Right. Well, I think it's really important, Ben, that we sort of define what we mean when we say artificial intelligence. There's a lot of buzzwords that are sort of thrown around there, but I think what vascular surgeons want is the ability to analyze huge volumes of data, look at patterns, identify patterns, and then use those patterns to predict outcomes and inform clinical decision making.
Yeah, so you're talking about machine learning.
Absolutely. And I think that's what most people mean when they talk about artificial intelligence, is the ability to use that computing processing power that exceeds our own mental capacities to do that with the amount of data that we access now.
Yeah. And how are you specifically using it, Randy? I know you're interested in this with regard to aortic aneurysm pathology.
Yeah, no, that's excellent. We spent the better part of the last decade developing AI-based software that actually pools cumulative information about aortic wall strength that'll eventually allow the clinician to develop a profile of the patient's individual aortic aneurysm wall strength and use that in some of their clinical decision making.
As far as being able to predict rupture or predict when patients should be treated?
Absolutely. So right now we're using basically historical standards based on size of the aneurysm to help make decisions, and it's really very crude and rudimentary, and there's a lot of positives and negatives that go along with that strategy. So we're trying to fine-tune that process to provide that clinician with an individual patient-specific assessment of aortic wall strength.
That's really, really exciting. And Ross, tell me about your involvement with imaging and artificial intelligence.
Yeah, so I'm just learning about it as Randy described. I think many of us don't understand it very well.
Yeah.
And I think a lot of us are always very skeptical of it as well. You know, you hear the stories of people saying we can get better detection of like breast cancer from imaging or better detection of brain images that are abnormal. And I think we always think, how's that really going to help us in vascular surgery? And so I've started to learn a fair bit more about it now. And I think one of the things that Randy just described to me has been the fascinating part of it. You know, we make decisions, whether it's carotids, whether it's AAAs, on data that's fairly old. Yeah. And it'd be nice to be able to have a good system that we could say this person's at high risk, whether they're 4 centimeters or 8 centimeters or potentially low risk. But that's where I really find this fascinating right now.
I find the predictive value of it also very interesting. There are some other platforms that are out there that the neurologists and neurosurgeons use to rapidly improve their workflows when patients present with an intracranial bleed or a stroke. And the CT scan machine learning is used to recognize a stroke instantly, and the patient's team is alerted within minutes. And I've seen some talks here at this meeting, the VEITH meeting, that have shown that the workflow decreases from 45 minutes to 6 or 7 minutes. And we know that minutes count when it's brain at risk. Do you have any comments on that?
Well, I think that's absolutely right, and I think vascular surgeons as a whole use huge volumes of imaging data in our day-to-day practice, and I think computer-based digital imaging AI algorithms are really going to make a difference in terms of our accuracy rates. If you think back to the breast cancer space, I mean, there's a lot of radiologists that are struggling for work now because we found that computer-based algorithms looking at breast cancer detection are much more accurate and much more accurate faster using a machine learning algorithms. Yeah. So I think that's going to have a very prominent role in the vascular space, that digital imaging processing.
Yeah, and Ross, if in your system in Chicago, if you could identify every single patient that has a CT scan and has the mention of an aneurysm in any artery, how beneficial would that be to your practice?
Yeah, that would be hugely valuable. And I think the other part that you mentioned, in addition to the neurology or neurosurgery, you know, we've seen the same thing with pulmonary embolus, right? That when identification of pulmonary embolus, teams get alerted and there's a rapid response for the same thing that you mentioned. I mean, the time is so important there. And for us with aneurysms, if there was a way that it could identify it and we would get the understanding of all these, obviously it would be great to be able to have the primary where we're managing this.
Well, all of the latest and greatest talks on AI as it relates to vascular surgery are right here at VEITH 2022. And we thank Frank VEITH for bringing this meeting back to us and making it such an extreme success again this year.